National Organ and Tissue Donation Awareness Week is held on the third week of April each year. NOTDA raises awareness about the critical need for more organ donors across Canada. NOTDA Week has just wrapped up, but the conversation about organ donation, whether it be registering your wishes to be a deceased donor or discussions about living organ donation, continues to be an important conversation with your loved ones. We are so pleased that joining us on Plugged In today to talk about kidney transplant and living kidney donation is transplant surgeon Dr. Mike Moser, who sits on the board of directors for the Saskatchewan branch of the Kidney Foundation. Thank you for taking the time to join us on Plugged In today, Dr. Moser.
It's great to be here.
Dr. Moser, from 50 to 75% of all kidney transplants are from deceased donor kidneys. What are some of the benefits of a living kidney transplant?
That's a good question, Susanna. To somebody who's waiting for a kidney transplant, a living donor kidney transplant or a deceased donor kidney transplant is a life changer. It's a lifesaver. But having said that, there are a few advantages to receiving a living donor kidney. And to many patients needing a transplant, one of the most appealing reasons to pursue living kidney donation has to do with waiting time. When somebody's waiting for a deceased donor kidney, you're on a waiting list, and that can mean a wait of, well, on average of about 3.5 years, if not more. And we have, of course, people who wait 6 months and they get the call for their transplant. We also have people waiting 5 years, 7 years, and even somebody who waited 14 years on the waiting list before getting their turn. So with a living donor kidney transplant, if you have a willing, motivated donor who's extremely healthy, it's possible to get a date for your transplant within 3 to 6 months. And along those lines, another advantage is that a living donor kidney transplant is done as elective surgery. It's not done as emergency surgery. So the living donation is done during the day. We pick a specific date on the calendar over a month in advance. And we know that on that day, the donor will come in at 8 a.m. They'll donate the kidney in the morning. And right away after that, in the afternoon, the recipient will receive their kidney. And that also means that the kidney is out of the body for as little time as possible. And that's got to be good for short-term and long-term function. Another advantage is that a lot of living donor kidney transplants are from close relatives. And that means the matches are going to be closer if you receive a kidney from your sibling or from an aunt or uncle or from a parent. And you add up all these factors together, and it makes it such that statistically speaking, somebody who receives a living donor kidney transplant will have that kidney work for a couple of years longer on average. Having said all that, deceased donor kidneys can be excellent, and whether a person receives a deceased donor kidney transplant or a living donor kidney transplant, it's clearly the gift of life.
Definitely, I can attest to that. So Dr. Moser, being a transplant patient myself, I'm post-transplant 12 years. So, when I hear the average is 13 to 14 years, my time is coming up to find a potential living donor. My question is do people go higher than 13, 14 years?
Yeah, I think that's the thing. It's a statistic, and we all know what statistics are. They're a lumped together average of a whole bunch of individuals. And definitely, we've got a lot of happy stories of people who have their kidneys for 25 years. I'm aware of one with 36 years and one who's been over 40 years with his.
That's amazing. I love that. Higher the numbers, the better.
We do too. Yeah.
Dr. Moser, what can you tell me about the surgery to donate a kidney as a living donor? I've heard some talk about a keyhole surgery. Could you tell us more?
Yeah, for sure. Keyhole surgery has greatly changed the way a lot of surgery is done, but it's definitely made living kidney donation a lot less onerous, a lot less difficult for the donor than it was in the past. And just as an example, in the old days, and by that I mean prior to 2008, 2009, in Canada, the majority of living kidney donations were done via open surgery. And this involved a very large incision, very large cut, started on the front of your abdomen, worked its way around the side, what's known as the flank, and then into your back. And so for a living kidney donor, it was a long recovery, a big incision, quite uncomfortable. And with the keyhole surgery, which is also known as laparoscopic surgery, The keyhole refers to the fact that there's 3 or 4 tiny incisions, less than a centimeter in length. And through those little openings, it's possible to insert a long, tiny camera and then use the other openings for tiny, long instruments. And with that, we can free up the artery, the vein, and the ureter of the kidney, free up the kidney, and then remove it that way. The largest incision, of course, we still need one that's about 6 centimeters in length, and that's to take the kidney out sideways. Interestingly enough, between 2009 and 2019, they noticed about a 30% increase in living kidney donation. And there's probably a lot of reasons for that. I'd like to think one of them is that the surgery to donate a kidney has become a lot less difficult for the donor, a lot less onerous for the donor, and that's led to that 30% increase in living donation worldwide. To the person who donates, it's a much faster recovery. It's usually a couple of days in hospital, and it's a faster return to work. Most people are back to work at 6 weeks, but depending on what they do, it might be as much as 3 months off work.
When I was on dialysis, I was quite young and I didn't have a voice, and I didn't know how to ask my family and friends to step up to be a living donor or even get tested. How do the kidney patients find a living kidney donor, and how would you suggest they ask?
Well, there's a lot of things we ask for in life, and this has got to be one of the more challenging things to go out and ask somebody about. And I think what I've heard from a lot of people is it's not so much about asking people, it's about getting the word out. It's about informing your family and friends, having a conversation, telling them, hey, you know, I'm on dialysis. Dialysis is not great. It's keeping me going here, but it's not great. A transplant would obviously change my life. And, you know, there's living donation as possible. And, you know, did you know that if a person has 2 healthy kidneys, it's possible to donate one, and that'll make all the difference in the world in my life. And, you know, be informed, know the answers to questions that potential donors might have, know a little bit about the surgery. And of course, have those contact numbers available. Make it as easy as possible for people to follow through if they're interested in donating. And, obviously the transplant programs don't call the donors. It's up to the donors to call us. We've heard of people who are looking for living donors who actually give out little cards with the numbers, and we have some cards available. The number of the living donor coordinator to call to get the whole process started if they're interested, or even if they just want to find out some more information.
Well, I appreciate that. It definitely gives me more encouragement for when the time comes if I ever needed a second transplant. So thank you.